Great. Good afternoon, everyone. Thank you for the opportunity to present today. So as Lottie mentioned, so Medpod is a separate company from Henry Schein, but works in close conjunction with Henry Schein, both in the U.S. and across the world. And we're very happy to be able to present the Medpod offering today. One moment here. Can you see my screen okay? Great.
I can see you fine. Yeah.
Great. Thank you. So obviously with COVID-19, the challenge is how do you still see patients and how do you potentially introduce telemedicine or teledentistry into the practice to be able to continue to see patients both from an emergency perspective and engage patients remotely. Clearly, we think that's critical and important. We think the other part that Medpod is clearly goes beyond video visits into a full-blown platform, and I'll talk about that in greater detail. So again, our focus here is to be able to provide a simple, easy-to-use video platform that provides tools that allows providers to connect with their patients remotely, and then hopefully utilize the Medpod platform well beyond COVID-19 as part of their overall practice plan, as well as marketing to engage patients. So I'm going to just show a brief video, a whiteboard, an overview. I do apologize that it is focused more on the U.S. market, but I will speak to the differences in a moment.
At Henry Schein, we know this is a challenging time for you, your staff, and your patients. Now more than ever, re-engaging and retaining your patients is critical to keep your practice running. So we're introducing Medpod Video, a web-based platform for easy, virtual consultations on any computer, anywhere. Over 70% of consumers would consider seeing a provider virtually, and we have the technology to make it happen. Medpod allows you to remotely provide consultations, assess and triage dental emergencies, and also enable post-procedure follow-up care. Through this innovative platform, you can diagnose the level of pain, assign a priority to the case, and make it easy for patients to access your office in a much more meaningful way than a phone call. It is HIPAA compliant, and teledentistry is now reimbursable by many payers, given the current health environment. And the best part is, no hardware or software installation is required. With Medpod's integrated language translation, you can also engage patients in any language. Let us help you stay personally connected with your patients when you cannot be with them face-to-face, so that you and your team can be accessible 24/7. Contact us for more information today about Medpod Video. It takes less than 15 minutes to set up, and we're here to help.
So I would just make a couple of comments about that video. Clearly, there's a whiteboard video specific to the UK market. We are GDPR compliant. I know HIPAA does not apply in the UK. In addition to that, reimbursement is not the same as it is in the US, but clearly we understand the play as it relates to being able to engage patients. So as I mentioned before, now more than ever, the real goal is to be able to engage those patients, see them remotely, be able to triage dental emergencies, and reduce exposure to COVID-19. Very simple, easy to use platform, 256-bit encrypted both ways, custom URL link that goes to your patients so that they can engage with you directly. You're not using your personal cell phone to engage with patients and do FaceTime or other non-encrypted mechanisms to contain or engage your patients, both COVID-19 and beyond. And it's very simple and easy to use. There's nothing to install on either side. Everything is web-based. So you only pay for what you use. There's a setup fee and then a fee per encounter. We have unlimited subscriptions available if you feel you're going to go well beyond the nominal fees that are in place on a per encounter basis. As I mentioned, there's nothing to install on either side. It uses any smartphone, tablet, or computer. You need a webcam, a microphone, and an internet connection. We use Chrome across most devices, and clearly for iOS devices, meaning iPhones and iPads, we use Safari. And it really allows the provider to control how they want to see patients. So you have an incoming call queue that can be managed a couple of different ways. You can set it up so the patient can see the next available provider if you want to provide urgent care, or you can schedule visits where a patient will show up at a specific time and allow them to engage with their specific provider. We also allow the ability to have a custom branded virtual waiting room, so you can provide messages specifically to your patients that you want them to see while they're in that virtual waiting room. So from a provider workflow perspective, particularly here in the US, most folks want to get up and running literally within a day or so. So typically what they're doing is setting up the appointments in their existing practice management system, and then scheduling the patient and walking through the video visit. So really simple, straightforward. You're going to schedule the visit using your existing systems. The provider is going to log into Medpod. Their username and password is specific to them, and it allows them only to see their patients. They determine their availability. The patient will come into the incoming queue with key information, their name, date of birth, and chief complaint. The provider can then review that information, accept the call, engage the patient, have the virtual consultation, and that's it. You just had a simple, very easy to use video visit without having to install any hardware or software, either on the provider side or on the patient side. So again, the goal here is to use your existing systems. I'll talk about integrations in a moment and what's coming, but right now the goal is to get up and running as quickly as possible. So you would book that appointment the same way you do today in your existing systems and engage the patient. So from the provider side, the provider is always going to go to the same login, pod.medpod.net. Their credentials will lock them into their specific practice or organization, and they'll only see their patients. And then there's a series of tools that are available to the provider, which I'll show you in the live demo. We have a virtual waiting room that you can see on the left-hand side of the screen that allows you to see how many patients in total are in the virtual waiting room for the practice, how many patients are available specific to a specific provider. You can go on break, make yourself available, or release a call, and then specific volume and camera controls relative to your engagement with that patient. Again, simple and straightforward. The patient appears in the patient queue, as I mentioned before, with key information. The provider accepts the call, engages the patient, and you're having a video visit. And that's what it looks like from the provider side. And we also offer language translation services. So if translation services are required, a person trained in medical terminology is available on demand via video that comes on and interacts between the provider and the patient. If you don't use it, you don't pay for it. If you do use it, you pay for it by the minute. And we have many folks that use this as a standalone offering in order to provide language translation services. And again, very simple, straightforward, end the call, and you just had a video visit. So from the patient perspective, again, very simple and easy to operate. The patient's going to go to the practice or the organization's specific website. So that website is branded to your practice or organization. So if it's XYZ Dental, it would be xyzdental@medpod.net. Clearly, we would think that that would be available via the practice's website as a means to be able to link in depending on how you want to deploy and offer services, either for scheduling or for on-demand visits. Again, the patient fills out very basic information, their name, their date of birth, their reason for the visit. They select a provider or next available. Again, that's managed by the practice or the organization, depending on how they want to manage their patient queue. They come into the virtual waiting room, which can then be branded specific to that practice or organization, and then they engage with their provider. Very simple and straightforward. Screenshot of what the patient login is. As I mentioned before, simple, streamlined, doesn't matter what kind of device you're on, whether you're on an iPhone, an Android tablet, a full-size computer or other, all the information appears the same way. They select their provider or next available. Again, that's being managed by the organization, how they want to manage their queue. The patient enters the virtual waiting room and they engage. Very simple and straightforward. I think it's important to note that beyond video visits, Medpod was really built as a platform that goes well beyond video visits. So I just want to take a moment so everyone understands that, Medpod really was built as, I like to say, a telemedicine and teledentistry platform. But when I ask 10 people the definition of telemedicine or teledentistry, I'll get 12 different answers of what it means. They're all valid answers. It depends on your frame of reference. But more importantly, we think we've built a very powerful software-based platform that allows you to do language services, video only, full-blown telediagnostics, and I'll explain what that means. And then on the medical side, remote patient monitoring to be able to capture data from patients at home in a chronic disease state. I think the other important part to note is that we don't operate a provider network. Our whole goal is to empower you as our customers to take advantage of the software and hardware and engage your own patients. At least in the US, there's a lot of large, quote unquote, telemedicine and now teledentistry providers or services that outsource your patients to their providers. Our whole goal is to make sure that your patients are staying in your ecosystem and your patients are being seen by you, their provider, not just any provider. And you can make this part of your overall practice, not only today as part of COVID-19, but post-COVID-19, because clearly we know, and all the data shows that, telemedicine and teledentistry is not a passing fad. It's clearly here to stay, and it will change how and where we engage with patients on a go-forward basis. And again, there's no software to install, there's no license fees, everything is encounter-based and subscription-based services. So if you don't use it, you don't pay for it. So more broadly, just want to quickly go over what the overall platform looks like and why this is important. So when you make a choice about what video visit provider you want to use, understand that there's a roadmap that goes well beyond video visits. So as I mentioned, video-only capabilities to engage patients. Mobile dock, which I actually have one behind me that brings a whole range of hardware options to be able to engage with the patient. It weighs less than 30 pounds. It goes to where the patient is, and you can bring care to the patient. The light card to be able to provide services on site, and on site does not have to be a healthcare office. It could be a school, a hotel, a prison. It could be lots of places where care is needed. And in many cases, we have medical professionals that are looking to bring dental care into those locations and encounters, and vice versa, dental locations that are providing services that want to bring medical services into play. And again, I'll mention schools as a very important part of being able to provide both medical and dental care simultaneously. The full-size cart, which offers a wider variety of options, remote patient monitoring for medical chronic disease state, and translation services. So again, Medpod's part of an overall broad platform. Video visits is just one component of the overall Medpod platform. Just a quick moment on telediagnostics and what I mean by that. All the devices that you see in the center and the right of the screen are integrated to Medpod, which means the remote provider merely using the internet and their log on to Medpod can turn these devices on, off, capture audio, video, clinical data, annotate images, and then the data that we capture can be pushed back into your host system. Our goal is not to replicate your practice management system or your electronic health record in any way. It's merely to interface with it to make it more efficient and easy to use, and you don't have to build separate interfaces for all these devices. We've already done all that heavy lifting to make that happen with a single click. So from a systems integration perspective, clearly a whole bunch on the medical side, a bunch pending on the dental side as well, including software of excellence, which makes it easier so that scheduling is available and visible in Medpod. That is a pending integration along with the other Henry Schein software products available in the US. The mobile dock specifically, just to touch on, all the devices that are available, and I'll mention specifically in the dental space, portable x-ray, intraoral cameras, caries detection, etc., all available in a portable device that can be brought to where the patient is to provide care in any setting. So again, whether that's a school, a prison, long-term care, assisted living, other places where care typically is not administered without having the patient leave the facility. So just quick on some of the case studies that we performed in the US. So we provided care in group homes for intellectual and developmentally disabled folks that typically would leave the group home and go in an ambulance and be admitted to a hospital. We reduced the incidence of those folks ever leaving that facility and providing care on site by 86%, saved literally $2.4 million just for the cohort as part of the study, and over $138 million to the larger group, extrapolated across all of New York State, well in excess of $1 billion, and changed the reimbursement regulations as it relates to the use of Medpod. And I mentioned schools before. We think this is a great opportunity to expand dental care into places where that care is not currently being provided today. In their first year of operation, saved over $500,000 utilizing Medpod, And we literally have more than doubled the size of this program since this study was first put out in the fourth quarter of last year, and have grown to 24 units in this facility going forward. And again, I think it's important to note that, you know, programs start off as video visits, can move into telediagnostics and teledentistry, and expand how and where care can be delivered. So with that, I'm going to give you a quick live demo. So give me 1 second here. So now I'm logged in as a provider on the main Medpod screen. On the other screen, I'm going to come in as a patient. As you can see, this is my demo account, so it'll be slightly different in the UK as it relates to the naming conventions, but quick tips on how to have a great encounter from a patient perspective. Very simple, easy to use. Start your registration, very simple. I click confirm. I click consent, and again, that's up to the practice or the regulations specific to the UK, whether or not you need a consent form or not. I can either select the next available provider or the specific provider, depending on how that appointment was set up. I connect to the waiting room. I just verify that I'm actually here. And again, this becomes a personalized virtual waiting room based upon the provider of practice. On the provider side, I see the key information I need, and I answer the call. I am going to mute the volume, otherwise I'll have feedback. That's it. Sorry. I'm going to kill. I'm having a video session within a video session, so I don't want to have additional feedback. But that's it. As you can see, very simple, easy to use from the patient side, simple to be able to engage regardless of what kind of device the patient is using to be able to engage with the provider. From the provider's perspective, I have one place to log in, and then I can manage my patients, whether I'm having video visits or I go into full-blown telediagnostics and other tools, because you'll see on the screen, there are other tools available, including clinical diagnostic tools and exam tools, depending on the devices I'm connected to, clinical decision support through Visual DX, which allows clinical decision support through a vast library of reference materials, and language services, which I mentioned before, are available on demand. So I click the button and the available languages come up, and I can engage a translator live. So again, very simple and straightforward in how Medpod can be utilized. I'm just going to take one more minute and connect to a device so you can see what I mean by telediagnostics. So I'm going to connect to the mobile dock, which is just behind me here. So on this device, I have the tools that are available. All the tools are integrated. So if I put on the SPO2, I'm not storing and forwarding. The data is being captured live off of Medpod and being pushed from the local side, available to where the provider is with the patient, to the higher level provider on the remote side. And the data is captured and shown here and would flow into the host system from there. I think also important to note that we have a wide range of intraoral cameras, et cetera, that can be controlled remotely, so that remote provider can capture, turn on that device and capture that image based upon what he or she wants to see. And then once that image is captured, annotate that image live for that patient. Sorry, that's not a great image, but I'm playing the provider and the higher level provider and the patient. I can annotate this image, assuming this was an intraoral image, and then it's shown live to the patient on the other side and then sent to the host system. Again, very powerful, but simple and easy to use tools that go well beyond video visits into full-blown telediagnostics in a variety of different settings. So with that, I thank everyone for your time. Hopefully you see the value of the Medpod platform goes well beyond video visits into telediagnostics and the ability to provide care outside of the practice.
Thank you so much, Todd. So we've got a couple of questions, if you wouldn't mind.
Sure.
So the first one, would you advise having a provider on hand to answer the calls at all times, or would you schedule a specific time for certain providers?
I really think that's up to the practice and how they want to offer video visits, and is it specific to the response to COVID-19, or does it become part of their overall practice plan going forward, and how they want to engage patients. You know, clearly we see that patients are more than willing to engage with providers remotely using video, even due to its limitations of what you can and can't do via video. So we offer the flexibility that you can manage it both ways. The most important thing that I would say, though, is regardless of how you want to manage your patient queue, either next available or scheduled, make sure that if you do offer that the provider is actually scheduled. It seems like a very simple thing to do, but we've seen instances where providers set up and utilize the Medpod and they don't ensure that a provider is available for a patient. It's no different than the physical world. You have to have a provider available, but we offer the flexibility to have it manned both ways. And again, it's entirely up to the practice. We're not running your teledentistry program. We're merely empowering you and giving you the tools. And then we can make recommendations on how you can best take advantage of that. But really, it's up to you. If you want to offer on-demand services certain hours of the day, make sure someone's available. Otherwise, schedule your patients.
Perfect. Thank you very much. Okay, the next question. Can I personalize a platform, i.e. brand the platform?
Yes, so we can white label the platform. So from the provider side, obviously Medpod, but from the patient side, it will be branded as the name of the practice or the organization. That includes the URL as well as the virtual waiting room experience.
Fantastic, brilliant. We've got another one come in. It says, can multiple users from the same practice use this system from the same network?
Yes, absolutely. So everything is username and password based. So you could have literally 100 users in a practice. Everyone has their own username and password. They will all connect to the same mechanism for that practice, meaning they'll only see the patient specific to their practice. But yes, multi-user.
Brilliant, thank you. Does Medpod work on all platforms?
So Medpod is a cloud-based system. So the short answer is yes. The only requirements are a camera, a microphone, an internet connection, a Chrome browser for all non-iOS devices, and a Safari browser for iPhones and iPads.
Okay. Next question. Does Medpod record the session?
We do not record the session per se. However, if people wanted or providers wanted the session recorded, we do have mechanisms to do that, but we're very mindful of the rules and regulations. I mentioned we are GDPR compliant, no different in the US, HIPAA compliant. Many folks do not want recorded sessions due to liability.
Brilliant, okay. I've got a couple more. Can Medpod be used by dental hygienists?
Yes, so again, we don't determine the mechanisms by which providers provide care. I will say in the US, on the medical side, we actually have multiple levels of providers. About 2 years ago, there was a new position created called a telepresenter. So on the medical side, that's below a tech or a medical assistant, and someone that's merely there to engage the patient and facilitate the engagement with the patient, with a higher level provider providing oversight. So the short answer is yes. And again, I would mention, schools and other mechanisms to say, whether it's a dental assistant or hygienist, whatever the title is, potentially provide on-site care with oversight by a higher level provider remotely.
Brilliant, thank you so much. I think we've covered all the themes there, but what I'll do, I'll share a link in the chat where there's a website where anybody can ask more questions if they need any further information. Absolutely. So thank you very much for the presentation. It was brilliant.
Thank you.
Thank you. Speak to you soon.